Welcome back. This section of your training is actually going to go in-depth of our brochure. This is something that the patients are given. This is a tool that we hand to every patient that we have, whether they're new, whether they're returning. We want to make sure that they understand the services that we have to offer. So you should have this pretty much memorized inside and out. I want to start with the section straight in the middle, and it starts with laser photorejuvenation. I start there because there's two areas of expertise that Dr. Melly has, and that's with our laser resurfacing as well as our dermal injectables, which we call a liquid facelift. Because they're such popular services, you're going to see that when we dive into the actual software to make these appointments happen, to make kind of the brains behind our daily business. I want you familiar with the services beforehand. That way when we start, you will have a better understanding and a better grasp on where to go from there. So to start with, what I'm going to do is we're going to go over the laser photorejuvenation, which is in the center section of your tab. And what you'll see is this procedure is done on our GentleLase. Our GentleLase is a 755 nanometer wavelength. It actually is a procedure that is going to help a variety of skincare concerns. So whether you have fine lines, wrinkles, hyperpigmentation, discoloration in the skin, the laser photorejuvenation is going to be one of the best treatment options to offer your clients and your patients, as well as one of the fastest result-driven lasers that we have on the property. So what I want you to do is I want you to familiarize yourself with that procedure. Another thing that's very, very important and very key that we do here at the Laser Institute of Pinehurst is we document our progress with our patients with progress notes, as well as we have pictures taken. Pictures are key, and we even have them, we take the time to implement them into our schedule to make sure that they're being done. We need follow-up pictures and pre and post pictures so that we can see the work that's been done. Many times we'll have patients who may feel like they didn't see as big of a result as they had anticipated, only to find out that they didn't remember how big of a change that actually needed to take place. So we want to make sure that we document everything with pictures. The laser photorejuvenation is actually a treatment that's going to stimulate collagen. It's going to reduce pore size. It's going to help with hyperpigmentation, which is typically called sunspots, which is huge in our area. So we want to absolutely make sure that this particular procedure you know in the ins and outs of. This procedure takes about an hour from the time that they arrive to the time that they leave, with only about 15 minutes actually in the treatment room with the physician. So we want to make sure that as a staff, we have our physician on go when it's time for her to go, but she doesn't have to be bothered with that whole hour. She'll actually have other patients in the meantime that she's dealing with. The way that this procedure will look, patient will come in, they'll check in. If it's a new patient, obviously we're going to greet them, offer them our tour. We're going to have them sign our new patient packet, and basically welcome them and want them to feel at home. Then they're going to go straight from their tour into our consultation room, where they'll either go ahead and have their consent signed as well as have their pictures made, and then we apply a numbing agent on this particular procedure. As you get yourself more familiar with the treatments and as training progresses, you'll see this stuff will come second nature. So we want to make sure that we are used to that, and that's something that we'll have set in place. So a little bit more about the photorejuvenation. As they are numbing, that's that time where I told you the doctor will be busy with other procedures that she'll be doing throughout the day. You'll get used to implementing that into our system as time progresses. Once that particular patient is ready, the office staff, or we have a patient care coordinator that will take that patient to the face wash room. They'll have them cleansed, they'll get them ready, get them set up for the doctor to come in to do the procedure, and then the procedure will take place. We have to make sure from the end of that procedure to the checkout that we have a smooth transition, that patient has been made aware of what they can expect to happen between that procedure and the time that they go home and the time that they come back for our follow-up, which is expected for them to come in. We have a sign as you leave our office that says, During any of our laser procedures, sunscreen is mandatory. So we want to make sure that they know what we expect of them from our point of view to their standpoint. So that's something that as you progress in this training as well, that you will become second nature. We offer all of our patients the chance to take advantage of our skincare products that we have here. We have found successfully that when you couple our skincare with your procedures, it makes them that much more effective. So we want to have our patients have the opportunity to actually protect their investment. They're investing in us, they're investing in our machines and our equipment and our time. We want them to take the second step to invest in their own skincare at home. And that actually is going to set the stage to make procedures and anything that we decide to do from that appointment on much, much, much more successful. With that, we're going to go over to the dermal injectables. I picked these two procedures to speak with you about first because they really are the most important procedures that we are doing in our office. We want to offer the most advanced technology possible. Our dermal injectables right now is absolutely key. No patient that walks through our door should leave without knowing that we offer Botox, Juvederm, our fillers, and different procedures of that nature. I want you to understand that there is a difference between Botox and Juvederm. One of them is they're all under our injectable category, and you'll see that. But what it is our Botox is going to actually be, your results are going to take a little bit longer to see. Usually within 3 days up to 2 weeks it could take effect, and what it's doing is it's actually paralyzing that muscle to cause changes. So it's going to reduce the look of fine lines, wrinkles. We typically will use it in the forehead and around the eyes. Dr. Melly has mastered different techniques, and she talks with her patients during the consultation to let them know that there are different areas we can put Botox in the face to actually cause changes for the better. So keep that in mind when you're being asked about Botox. When you're being asked about fillers, fillers are going to be a little bit more instant results. Of course, it's going to be coupled with a little bit of swelling, mild bruising, but you can actually watch Dr. Melly feel that particular line. So that's something that we want to let patients know. There's a difference between the filler, there's a difference between the Botox, but both of them really go hand in hand as far as creating an outstanding look of a facelift with no downtime. So we want to make sure that with our Botox and with our injectables, as far as the Radius, the Bellatero, the Juvederm, that we know the difference between the two, how they're actually injected, what they do, and that'll make you feel a lot more comfortable. Our Botox, we actually run $15 a unit. On Botox Tuesday, which we want to try to keep as much of our Botox business kind of on that particular day. She has to mix it up ahead of time, so we want to have it handy to where she can just quickly get patients in and out and provide them with outstanding service. So on Tuesdays, our Botox is actually 20% off, which brings it down to $12 a unit. We occasionally will run specials, and of course we keep you posted on our specials right from the beginning. Every month you'll be very, very familiar with what's going on, what specials that we have, so you'll feel comfortable talking about specials with your patients. Our dermal injectables are $600 a tube right now, and that's something that is going to last them about a year. So those are things when you're talking prices. Your Botox is going to last you a little bit shorter of amount of time, usually 3 to 4 months before you need a repeat visit. Your dermal injectables can last you up to a year, even more. And of course, as you get more familiar with the procedures and maybe have some done yourself, you'll be more comfortable talking to patients about this. I do expect you from the end of this portion to sit down and write out some concerns that you have and see if you think any of these particular procedures, the three that we talked about, the Botox, the filler, and the photorejuvenation, would be something that you would benefit from. So with that, I want you to just do your little bit of homework. I want you to write down some things that you're concerned with, that you have. That way, when I sit down with you and we almost have an informal consultation to find out what your skincare needs are, so you can see the format of a consultation, you'll be a little bit more familiar with what we're talking about.